working? Does anyone have any questions? Bridget?
I was wondering if you've used at all this technology with teens. I know this is the college age group. What's been the outreach to teens? I'm thinking about teen parents. I'm thinking about parents who are very worried about their teen. They might be extremely excited about being able to support them putting an app like this on their iPhone or their Android.
So we hosted a tweet up when we launched on Android. The hashtag was Tech for Good, and we wanted to talk about ways that people were using the app in their lives. And we heard from teachers who said, we don't even have a way to talk about dating violence to 7th and 8th graders and teenagers. We've actually been showing your demo video as a way to talk about violence. So this was sort of staggering to us. And we looked at, there was a report in Pediatrics Magazine about the levels of dating violence and the lack of information at schools for teachers. So in collaboration with the professor who released that information, we created a dating violence toolkit for teachers. It's on our website, circleof6app.com. And it's very simple breakdown using teen-friendly language. Obviously, teens don't say danger, they say drama. Oh, I'm just having drama. You know, what's the right language to use for young people? I've heard from a lot of parents that they're using this for their daughters and sons around drunk driving, safety on getting home. So we know that teens are using the app and that parents are interested. And I have to look at our most recent numbers about how many people have downloaded the study that we wrote, but we were happy to just provide very basic educational resources about how to talk about violence to young kids for teachers.
It's great. Thank you.
Do you have a Chinese version?
Chinese version, right.
You need a Chinese version. I mean, the Chinese university students, you know, they're on the, you know, on their phones all the time, and it's a serious problem.
We have exciting plans for 2013, which would include translation and localizations, hopefully in China, if any folks would like to pro bono translate for us. I mean, we're in. Oh, fantastic. Excellent.
What makes that easy is it's not a very text-heavy site, so it's not huge volumes of, you know, many page translations to be effective.
Just another about that. We also need information about who are the best partners on the ground in China and by region, because, you know, we're lucky in the United States. We have national hotlines that have been vetted that we can trust. So the other key thing about the dissemination of this app is also our partners. We have great nonprofit partners. So helping us get the word out that we feel safe having users go to in an emergency. So,
Teresa?
Yeah, just a quick question on, you said 28 countries. What, in what regions of the world? Just, we can go online, but just to get a sense.
Sure. Primarily English speaking. So England, I think England, Canada, New Zealand, Australia are top ones. India is our second biggest market after the US speaking, especially after the Delhi gang rape. We've been showing up in the Indian media a lot. We're all over Asia. We're in Latin America. Where are we not that I was upset about? Why are we not here? I think we need to. We're not in Africa enough, I think. But are we in France? Yeah. So we're all over Europe, but I think, you know, the English-speaking India, and then kind of peppered throughout Europe.
Hello? Oh, thanks. So I have two questions. One of them is to kind of complement what Teresa was saying. In those countries, is it in English and people are using that, or have you actually gone out and translated this into other languages? That's my first question. And my second really has a lot to do with why we're here and really thinking about evidence. If you have any thoughts, I mean, I think this is fantastic, and it's kind of the cutting edge in technology in terms of the kinds of programs that we do on the ground. And, you know, a lot of people have access to cell phones now, even in places like Africa. I mean, we know this. And so it's such a good, amazing tool to be able to use. At the same time, we run into the same kinds of debates where it's kind of like, well, yeah, this seems great, but, you know, for me, like as a decision maker, I need to be able to say, yeah, it's great, and here's what we were able to show in terms of, you know, any kind of evaluation that's attached to something like this. So I'm just wondering if that's something that's even on your horizon, and if you're thinking about maybe partnering with an institution or doing something around evaluating this?
Absolutely. So to answer the first question, people are using, as Carol said, because it's not very text heavy and it's SMS based, they're using it in English. And what makes it international and universal is the GPS is international, so it can be used anywhere, and the custom hotline. So that number works anywhere in the world. You choose it, so the user can choose it, but it is still in English, and the process, it's not just simply translation, it's localization, which is our partners, and who's the right hotline, who's gonna help us get it out there. So that's definitely on the horizon for 2013. And your other question, which is another exciting reason about being here, about data collection and analyzing how this is working and how to improve it. Definitely, this was our first version. For version 2, we want to make sure we install the best, most useful analytics. I know, and I've heard this anecdotally, that universities actually don't want the data. They don't want to know how prevalent rape is on their campus. Just being part of that world and hearing that firsthand from all the women's centers. So if we did that and then said, oh, hey, University X, we have all this information about what's going on and where it's happening. Now you can make changes. What would really happen? Would the university be interested in that? So we're very open to conversations with organizations and institutions moving forward.
Yeah, and you might try some violence researchers at universities who might very well be interested in not your particular data about a particular school as much as how they could design a study and then apply for funding to evaluate it.
Are there any other questions? Evelyn?
Yes, it is on Android. Very excited, and I have to think about my circle of 6. But it really got me thinking in just the 20 minutes of how this really is, again, connecting to the theme today of how we connect to community and how we help the community promote the violence prevention messages. So maybe it's not so much documenting the number of sexual assaults, but the other people that are called the other variables, the prevention number 3, where someone, call me because I'm in trouble, or however I frame it. So there's just a lot of ways to look at this tool as a way of a prevention tool, not just measuring when an actual violent event occurs.
And to that point, what was exciting about having 6 people to put in your circle, I would hear from male students who would say, a friend of mine was raped and I don't know what to do. And we're at the beginning of the bystander intervention movement. I think Bell Bajau is totally in the vanguard, but there's not a lot training, especially young men, about how to bystand safely and how to intervene. And what we've heard is young men saying, oh, well, now there's like something tangible I can do. I can be part of someone's accountability circle, which is really exciting for us.
Just by coincidence, we just got results from a study we funded with 17 Magazine looking at the 15 to 22-year-old population, and we're expanding it to to the more general population for comparative purposes as well, and it's really looking at bystander behavior. And boys, 15 to 22, such a huge majority are eager to step in and be bystanders and be helpful, but just have so little knowledge. They talk about the issue so much less. They know so much less about the issue. So something like that would just, really make a huge difference, I think, in starting the conversations, because they don't really seem to know how to start the conversations with family, with friends. They think it's not talked about in their schools and it's not talked about in their colleges.
I
think I'll let Michael respond, then Jane has a question. And I think at that point, maybe we can take the questions over a break, because we do want to give you a real break before we reconvene at 2:10 after.
It's more of a comment, but I guess it's a question too. In suicide prevention in youth, developing a strong social support network is absolutely essential, and it's very hard to do because they won't talk to the parents, they won't talk to their teachers and stuff. And this sounds like an ideal method for suicide prevention. And I don't know if it's been applied or there's been ideas of moving it there, but certainly with youth suicide, that seems a great way to go. Also shows how dynamic the culture is and how you have to change with the changes in the culture and your technology and your approaches to trying to deal with people over time.
So my comment is just a connection for you. If you haven't talked with Futures Without Violence about the Start Strong program, this was a 10-site demonstration in middle schools on building healthy teen relationships. That is a absolutely perfect vector site for getting this down to the middle school level with parents and teachers, and there are a huge number of resources there. And those sites are spread out across the United States.
Okay, so now you get a real break. You don't have to eat during your break. Let's be back in the room at 10 after, and we have an exciting program planned. Thank you.